I want to first of all thank not just our panelists and moderators, but everyone in the audience for rushing through lunch. So at least we have some audience here. Fantastic. All right, well, I am here with my Emmecell hat on to present what the actually latest update on data and approach. Of course, we all know here that cell degenerations underlie most of the major causes of irreversible vision loss. Emmecell's platform is magnetic cell therapy, and the concept there is that the magnetic cell therapy allows us for delivery and retention and ultimately integration of the cells into where they're supposed to be. Emmecell is a clinical stage company, as I'll share with you in a moment, with a really fantastic team. It's been a pleasure to work with over these years. First lead indication is going after corneal endothelial cell disease, which of course, as this audience knows, is the degeneration of those cells just inside the innermost layer of the cornea that we treat with DSEK or DMEK these days. But Emmecell's technology allows for a fundamentally different approach, and that is to take the corneal endothelial cells, bring them back into the GMP laboratory, expand them up from one donor cornea into 1,000 doses of cells, label them with magnetic nanoparticles along the surface that allow you to then, instead of doing a surgical approach, just inject the cells into the anterior chamber. And the patient, just right after the injection, can wear a magnetic patch that helps pull the cells right up to the inside of the cornea. The patch actually sits on the outside of the eyelid, not diagrammed here. And this really can, this non-surgical approach can really change the flow of how we treat these patients, because now we can let the general ophthalmologist, which greatly expands from the cornea specialist numbers, identify the patient in need. They get shipped a kit, and they can just do this injection right in clinic. And in fact, here's a picture, I think, of how it can work in clinic. Here's also a video showing, this is of course in a tube, not in an eye, but you can actually see how within seconds, less than a minute, the corneal cells all get pulled right up against the magnetic facing side of the tube here. Of course, if you flip the tube around, then you'll see again how quickly the cells all move across. And again, it's just to really illuminate for you how quickly the magnet can pull these cells into place where they're supposed to live, really obviating the need for any surgical approach. And this allows Emmecell to go after this really expansive opportunity. Right now, we're treating 50, 60,000 patients a year in the US with corneal transplant with DSEK or DMEK. But there's about 10 times as many patients who have corneal edema and are not going to surgery today. And so going after that much larger patient base with a much larger provider base, because it's non-surgical, any ophthalmologist, general ophthalmologist can do this. And that really creates a new category and opens up a very big market opportunity. The US multi-center double-masked randomized trial showed very high efficacy, rapid recovery, high safety and tolerability. I'll remind everybody that this is with no endothelial scraping. This is just injecting the cells in. And you can see at the best dose, which was actually 150,000 cells, is all you need. And we can see even by week 1, this is a great patient and provider satisfier. Even by week 1, the vision is already showing that improvement, on the way to 10, 11 letters gained. Why don't we need more cells? Well, again, with magnetic cell delivery, you can see if we tried to deliver 1 million cells, the picture on the left, it's way too many cells. The normal human cornea only has about 250,000 cells. So with 150,000 cells right away, you've got this real wonderful corneal clarity. Great outcome measures, 11 letters gained. 3-line gainers looks fantastic. 63% of patients cresting over 20/40, which is driver's license vision in most states. So really fantastic. Ellen Koo in Miami has now presented data from her subset of patients showing that it turns out that these cells, once inside the cornea, are disease modifying. They're actually remodeling the basement membrane, which in Fuchs has these little dot-like excrescences, and reducing over the 6-month period that these patients were followed, reducing by about 50% the excrescences, the gutata on the inside of the cornea in these Fuchs patients. So really amazing early preliminary data saying that this is disease modeling, remodifying, again, without scraping the endothelium. Finally, the last slide I'll just share is just, this is fresh off the press. We just did an additional study where we asked whether redosing is safe and or effective. And what we showed, again, in an additional new cohort of patients, that redosing, which you can see happened there at 6 weeks, you can see right on that day that the patients are blurry just right after the injection. But again, by 1 week, they're showing the visual improvement, again, showing 10, 11 letters gained in these patients. Interestingly, we also tested in this trial whether a ROCK inhibitor helps and found that the ROCK inhibitor does not improve vision anymore with or without. So it really says that with magnetic cell delivery, you really don't need the Rho kinase inhibitor on board. I'll just mention that we have a second product that targets geographic atrophy. The principle is the same with magnetic cell delivery, putting the RPE right where they need to be under the retina. That'll be in first in human later this year. So with that, really excited to share with you this non-surgical injection approach for the cornea, for the anterior segment. We think that that's going to really create a significant market expansion. GA candidate, equally excited by that, coming up close behind. And thank you very much for the opportunity to present.
Jeff, thank you so much.